hands up those who feel uncomfortable about going to the doctor about a mental health problem. Now, for those who are saying they're uncomfortable with it, which is just about everybody, what were you thinking? What sort of things went through your mind?
The worst thing that happens to teenagers is so much of what they're feeling gets invalidated because they're teenagers, because they're kids. And we have this perception that, oh, it's hormones, I'll just grow out of it, it's just a problem phase. If it's not a problem phase, they may have just walked themselves into a lifelong disorder. I was in my second year of university, and during that time I was diagnosed with an eating disorder called anorexia nervosa. So I was probably about 19, and I found myself engaging in behaviours that led me down a really awful path. I, being a psychology student, knew that the behaviours weren't okay. I knew that what I was doing was not okay, but I couldn't stop it. My mum has actually said to me the worst thing I ever told her during that period was that I stopped knowing who I was, because everything that came out of my mouth during that period was trying to justify behaviours I knew were going to kill me. And at the worst part of it, my iron levels dropped so low that I had to be hospitalised and given a blood transfusion, because my haemoglobin, which is a part of your blood, had dropped to such low levels that the doctors were actually surprised I was conscious. I cannot remember a day when I wasn't scared or uncomfortable, so it was pretty terrifying, and it was just incredibly confronting. Probably about 2016, I was officially discharged from the eating disorders program. I had gotten up to a good weight, I had stopped being terrified of food, all that jazz, and I just started seeing a normal, everyday psychologist to deal with the reason I got myself into that mess. And that was actually my anxiety disorder. My whole world is mental health, not just adolescents, but for adults. My research area, my whole career is based around mental health, and being able to do this and to really connect with kids and share what was honestly an awful experience for me with them so that they don't have to go through it, it's amazing. And yeah, I don't think I would be where I am if I hadn't have taken this kind of opportunity to share my story.
By children and young people hearing the lived experience of real people who they can connect with, they're actually more likely to go out and seek help. They're more likely to talk to their counsellor, they're more likely to talk to their parents or people who they trust.
I got the first symptom about 25 years ago. It became a very strong anxiety, sharp pain in the mind. Because of the stigma of it all, I stood outside his surgery, and even though I was in a lot of pain, I was thinking to myself, will I go in, will I not, will I go in? And I did. Reduce stigma, which is a large thing. If they've got some sort of problem, that they go and get help early rather than wait until things are a mess. And if they do have some sort of mental illness, they should not give up, that there's always hope that they're going to come out the other side.
I think it's an absolute help to be in a school setting because there are already networks of help set up inside the school. And there's also connections to the Australian curriculum where teachers are required to teach help-seeking behaviours and wellbeing lessons.
Could all the number ones please stand up? Just stand up straight. So, this represents the amount of people who will experience a mental health problem in their lifetime. Number twos, can you stand up? So you guys represent the friends, the family of somebody with a mental health issue. What have we got standing? Half? So that represents the amount of people in our population who will experience a mental health problem in their lifetime.
I found Alan's very interesting. I didn't realise how you can get so much pain and trouble through all that, and how long things can take to actually get over it.
Stigma really has a negative effect on people actually being able to reach out and go and talk about their mental illness, and that really stuck with me.
It's a powerful experience hearing about these stories and finding out about ways that other people have gotten to it, and maybe that'll help me or people I know.
I guess the key message would be just to listen to your kids. If they are having the courage to come to you and tell you that they think something's not okay, You know, it may have taken them weeks, months even to get to that point. So listen to them. If they say, I'm not feeling great, I'm always stressed, I just feel really unpleasant, my stomach hurts, take them to see someone. Be the person that helps them through that process, because there was no way in hell I was going to take myself to the doctor. You know, my mum just kept asking, are you okay? Is everything okay? Do you need help? And it was on my own terms that I came to her and said yes. But I wouldn't have if she didn't ask.
I think we're actually in a really interesting point in time where young people have access to so much information, but yet stigma is still such a big player in the mental health sector in help seeking. So it's really important to teach young people to and how to seek help.